Ladies and gentlemen, welcome to the ECHAlliance, the Global Health Connector Summit. This year, during the UNGA, we have tried to gather leaders from around the world, both in the room and indeed around the world online. We have, I think, about 1,000 people online at the moment, which is why we want to start exactly on time, because it's not fair to them, given that some of them are sitting up in the middle of the night, especially our good friend George Margellis in Sydney, who seems to not need any sleep any year at all. The Alliance has these summits to try to advance our own mission. Our mission, essentially, is to make sure that when people talk about collaboration, we all talk about collaboration, what I find is that often collaboration is simply words, simply good ideas. We must do something. I was talking to someone earlier who said, I go to a lot of these events. They tell me that everything's urgent. We must get something done right away. And all they talk about is the problem. So we focus on solutions. We want to implement, and we implement around the world by doing 4 things. One is we connect people and organizations. That may sound easy. It isn't. And also, when you connect people, it doesn't mean really good things happen unless you have a methodology to follow up, to encourage them. We also, of course, convene, example here today in Manhattan, but we also convene about 300 meetings a year around the world through our ecosystem network, which are based in either a city, a region, or a country, and more recently in different continents. And the key is that if we actually meet, talk about the problems, find solutions, and then next thing we do is we try to amplify. What does amplify mean? It means, first of all, publicity, making sure everyone knows what's going on. But it's more than that, because I find around the world there's a real reinvention of the wheel still going on. Things that people say, we must get a solution for this. And I said, well, have you looked at Oulu in Finland, for example? Have you looked at Kigali in Rwanda? Have you looked at some place here in the States? And the answer is many people do not know what is available. And more importantly, some startups, and I know a lot about startups, will tell you, my first question always is when I mentor them, if that's what I call it, mentoring, I'm not sure they call it mentoring. But essentially I say, who are your competitors? We have no competitors. Red flag warning. There are always competitors. And if there aren't, you wonder, is there a market? And you wonder why you think you should spend all your time developing something without checking whether there's a need in the market. I know that's basic, but I promise you it's the same all over the world, wherever you go. What we then do is we try to accelerate. Everyone needs money. We all want to do good. We're very good at doing good, at least in our heads. My worry sometimes is that the aspiration, while great, doesn't necessarily translate into action. And that is why you need an organization which is capable of taking the good in us, to do good with other human beings, to actually give them a way of doing it. The number of people have said to me, I want to do something, but I don't know what to do. So the first thing we do is we send someone a check, or maybe we send them a transfer or a contactless card these days. But beyond that, most people who want to do good are frustrated by the lack of a method to do good. So one of the ways to do good is to raise money, is to fund these startups, is to get funding for research, get funding from different organizations. So we do those 4 things. We connect, we convene, we amplify, and we accelerate. What I'd like to see at the end of today is that there is a call, not just a call to action, but action. We would like you to contribute during the day to the various panels and say, I know the problem. Don't keep telling me what the problem is. Tell me what the solution is. And then we as a group, each one of us have a responsibility, I think. And you wouldn't have turned up if you didn't want to be part of what everyone's trying to do. So please, at the end of the day, we want to have a call to action and actually real action points. So when we meet again next year, we won't be saying, we're going to do the same old thing again, because I don't want to do that, and I suspect you don't either. So those are my opening remarks. I maybe should say a word to our online audience, and to say that particularly those who are watching us from Africa, from Kigali and from Nairobi, and from Addis Ababa, I know they're online because these are friends of the Alliance, to say thank you for participating online, and thank you for the work that you're doing in countries who can be the examples in many ways to the rest of the world. So I'll close there and say thank you very much for being here in the audience, and thanks to the group online. Thank you. Finally, I'd like to introduce you to our partners today, and particularly, no, I don't think she needs any introduction actually, but I'll say Irene is all I'll say. So Irene, do you want to take the floor, please?
Good morning. Thank you so much, Brian. As he introduced, my name is Dr. Irene Ninge. I'm the Chief Science Officer at the Society for Women's Health Research. Founded in 1990, SWHR is making women's health mainstream by addressing research gaps and unmet needs in women's health. Our science and policy programs span health conditions, diseases, and life stages that exclusively, disproportionately, and differently affect women. As you can see, just 50 years ago, women of childbearing age were actively excluded from clinical trials. Physicians, medical researchers, and health advocates pushed for scientific evidence, policy change, and increased accountability over the decades to help change the landscape. Thanks to SWHR's efforts and other women's health partners in research and advocacy groups, women are now routinely included in medical research and make up a larger portion of the scientific workforce. And more scientists are studying how biological sex differences affect prevention, diagnosis, and treatment of disease. We're excited to welcome speakers today who were very influential in this, particularly even in this timeline, including Dr. Janine Clayton, who was the architect of the SABV policy at the National Institutes of Health, and the Office of the First Lady will speak about the White House initiative that was launched earlier this year. We also have women's health leaders from across the globe that have made similar impacts and are here to enhance our individual perspectives and strategies towards continued efforts in our respective homes. Women face unique challenges over the course of their lifespans due to sex differences in health and disease, as well as sociocultural influences on related to gender. These disparities exist across disease states and life stages that touch every ethnic group, geographical location, and socioeconomic status. That's why SWHR and ECHAlliance partnered to elevate this conversation during UNGA79 Science Summit. While women's health is easily associated with certain sustainable development goals, I challenge everyone here today to consider how women's health and the discussions that we have today will influence or are influenced by other goals, such as zero hunger, quality education, and reduced inequalities. In 2021, an economic and societal impact analysis conducted by the Women's Health Access Matters organization showed that investing $300 million in research with a focus on women across only 3 disease areas could cause a return in investment over $13 billion in economic returns that would improve quality of life, reduce healthcare costs, and more productive productivity at work and in the workforce. How much might this return on investment multiply if we expanded to the full spectrum of women's health issues, and we did it all across 7 continents and not just in the United States? This is why we're here today, to address this grand challenge. So on behalf of SWHR and ECHAlliance, I welcome you into our temporary home today here at The Cure. And we invite you, as Brian mentioned earlier, to engage this conversation. Don't just sit and listen, but how can you identify partnerships? What strategies have you implemented? What challenges have you encountered? And let's talk about how we can push forward together and advance women's health. I would also like to thank our sponsors for today's program, Pfizer and Johnson & Johnson, and to the Journal of Women's Health, who supported as a media sponsor. Throughout the day, we invite you to pose thoughtful questions, and as I mentioned, engage in the conversation. I challenge everyone participating today to identify one immediate step or change that you can make within your realm of influence, because everyone has a realm of influence that you can advance for women's health. And then consider a plan or a larger goal that you can do moving forward, and you can partner with somebody and take back and work on over time. We are recording today's live event, so it will be posted online and for future viewing and reference. And so as you accomplish these goals, please stay connected with us. We want to hear what you've done. We would like to connect back so next year when we return, we can learn from what we've done over the next 365 days. And so with that said, we will begin our opening plenary.